Hello, everybody. This is Elizabeth Clare Brewington with Elton Brewington, and we are with Brightside Global Trade TV. And we are very delighted to have Dr. Rajesh Khanna in our studio today. And there is something that we've been doing a lot with health and wellness because our conference is coming up. And we wanted to really dive into it. I know that many of you, like me, might have challenges reading on the computer. I don't know if you've suddenly noticed that you are squinting and you're looking at screens. So maybe this is our time to ask Dr. Khanna all those questions about our eyes. But before we go there, Dr. Khanna, can you tell us a little bit about yourself and about your book?
Sure. I grew up in India where I did my medical school and ophthalmology training. But I came to the US around 2.5 decades ago to learn refractive surgery. And I was fortunate enough to repeat a residency here and do fellowship training in refractive and corneal surgery. So it's not like how you might have heard LASIK surgeons went to a weekend course, but I did at University of Cincinnati for 16 months.
Hmm.
And so that the foundation was very strong. And so LASIK is, everybody's aware, is very good, gives you great vision. But this year there has been a renewed interest in LASIK because as people are wearing masks, their glasses are getting fogged up and they're having
Yes.
difficulties in vision, especially driving. Respiratory therapists cannot see what
Mhm.
they're working. And a lot of teachers who were used to being in the classroom have now to spend their time in front of Zoom. So they're facing so much eye vision problems because you're
Mhm.
focused at near. So the
Mhm.
presbyopia is the inability to see at near. So just
Mhm.
going back to my history a little bit. So when I was doing my fellowship in LASIK, I had a choice to go into practice or carry on into cataract surgery and
Mhm.
certify myself in that. So looking at the long term, I thought it will be good. And that turned very fruitful because when presbyopic implants came, people who had training in LASIK and cataract surgery could be the best people to do that. Because when only cataract surgeons did, the outcomes were not good, and LASIK surgeons could not perform the surgery. So I was at the right spot at the right time, and I made a paradigm shift in how we treat our patients in this country.
Mhm.
Traditionally, insurance pay you for every time you visit the doctor gets paid, and he gets paid for every surgery he performs. It doesn't matter
Mhm.
the outcome of the surgery.
Mhm.
So if somebody doesn't cure you, he gets paid more. I'm not saying
Mhm.
doctors do that, but I'm just saying that's the flaw in the system. If you
Right.
go 10 times, the doctor gets paid 10 times. So with
Mhm.
PI, I made a paradigm shift. You pay
Mhm.
once and we guarantee you the outcome. And we give
Wow.
lifetime enhancements. So let's say 80% of the people become perfect on first surgery, good. But if somebody needs some more fine tuning, that's all included. So it's on us to get them
Mhm.
best as fast as possible because the
Right.
last person who get left behind, we begin to lose money. And I think that's
Mhm.
one thing our former President Obama was impressed with that paradigm shift. And he was talking of including into the insurance based system. So the patients
Mhm.
can get cured fast. Everybody has skin in the game. And
Mhm.
that's what presbyopic implant in eye uh, delivers. And but
Mhm.
since everybody has a different concept, different doctors put out different things, some call it with the older name, some call, I decided to write a book so any person anywhere in the world can read through it and understand how to choose a good doctor. Eye doctor we are
Mhm.
talking, but it could imply for any any doctor for any field, and what
Mhm.
tests to expect and to make sure they are done. And
Okay.
even after the surgery, what to expect for the rest of your life. And if you're not satisfied, what more things could be done. So there is some
Mhm.
standardization in the pie process. That's what
Mhm.
prompted me to write the book. And it took me 3 years because, it's easy to speak,
Yes.
but then when you
True.
want to write, you have to also drum it down so an average person can understand who does not have
Mm,
medical training.
right,
So
right,
that's
right.
where we are now. The book has been well received by a lot of journalists and reviewers, and patients are loving it. And it took me 3 years to write, and it's like a 200-page book, but they're able to finish in 3 hours.
Sure, yeah, okay,
Yeah, that's
understood,
And I
true.
wrote
understood.
it in big print, so they can read
That's
easily.
right, so people can read it easily. Right, that's a
Yeah,
challenge, I'm sure.
that is.
Well, if I'm understanding, the presbyotic implant, it's a procedure, like laser surgery, and it's a permanent procedure. If I understand your description
Yes.
correctly.
So
Mm-hmm.
in the book, we discuss what's the difference between LASIK and PI.
Uh huh.
So I could show you an eye model, but
Uh huh.
basically the cornea is the front part, which does not
Uh
move, and the
huh.
lens is the central part, which moves and adjusts like an autofocus zoom of a camera. So
Uh
when
huh.
things come closer, the power becomes stronger.
Okay.
So for static vision, you can operate on the cornea. For when you're younger, you just change the shape of cornea, and the muscles and the lens do the accommodation for middle and near. But above
Okay.
45, the lens has become very thick,
Uh
and
huh.
this will segue to glaucoma also, because a
Uh
thicker
huh.
lens can induce more glaucoma because the
Uh-huh.
space is less, it's causing pressure on the outflow.
I
So
see. I
pi
see.
also decreases the chances of glaucoma because the natural lens has become this thick and the pi
Uh huh.
implant is so thin. So a lot of
Oh.
people, their pressure go down and they can avoid even drops. And we can
Oh.
even put
Wow.
in stents at the time of pi, just like hard stents, to
Mm-hmm.
increase the outflow. So
Okay.
that's very beneficial for multiple reasons.
Mm-hmm. Mm-hmm.
And
Okay.
so in the lens, what we are doing is we're not removing the whole lens. We make
Uh-huh.
an opening in the lens, clean out the contents by vacuum, and put an
Uh-huh.
artificial implant, which is customized to your eyes. We measure
Okay.
the length of your eye shape and come up with exact powers and how much focal length at which you want the best visions. And based on your previous surgeries, if you've had LASIK, radial keratotomy, or you have glaucoma or whatever, we can choose one of the 25 implants FDA approved available in the United States.
Mm-hmm.
But the basic
Wow.
thing I discuss in the book, before you jump to the top, the foundation has to be strong.
Sure.
So I talk of things doctors avoid talking about nutrition,
Uh-huh.
about eye exercises, how they can help, and when they are can be done, and when to shift to interventions of surgery. And another
Sure.
important thing is right to the base. What is the function of the eye? A lot of people
Right.
think eye sees. Actually, eye
Uh-huh.
doesn't. The role of eye is to take the information. The light starts from sun, bounces on different objects and come. So it's carrying information in it. So
Sure.
that information has to be focused on a certain point in the back of the eye where it can be
Uh-huh.
transmitted to
To the
neuroelectrical
right.
signals and go to the back of the brain where the
Uh-huh.
world is created. You will be
Right.
surprised to know only 10% of the information is taken and 100% created. So brain
Uh,
multiplies it by 10 times.
okay.
So
Okay.
we can train the brain to see.
Mm-hmm.
But
Mm-hmm.
it's not possible if you have a half diopter, it's possible, but not when it's five and all. So when
Okay.
the most important thing what we are doing with LASIK and PI is trying to bring the information in and removing the noise.
I see.
The
I see.
noise is the artifact which interferes with vision, and we call it glare, halos,
Uh-huh.
shadows. Different people describe differently. So
Okay.
this
Okay.
becomes very important because pi is the only surgery which improves even with time. Every
Ah.
other surgery, including LASIK, deteriorates with time. Pi you
Uh-huh.
can be 2020 week one, but at 1 year you'll see even better. At 10
Wow.
years you'll see even better
Wow.
because the
That's amazing.
brain is getting the information and learning how to extract more out of it. So this
Mm-hmm.
whole surgery is such a big game changer because it's going into physics of wave
Mm-hmm.
theory, it's going
Sure.
into vision optics, It's
Mhm.
going into
Mhm.
surgery, and then
Mhm.
finally brain seeing. Because
Mhm.
when you look up on Amazon, you see so many books: how to get better vision without glasses, how to eat
Mhm.
for health.
Mhm.
This book combines everything and gives everything a proper place in life. Because I've seen
Mhm.
so many people do different types of therapy trying to cure myopia or presbyopia, and they don't work. They'll work
Mhm.
in
Mhm.
once in a while, but they'll keep
Mhm.
pushing, and people won't scared of surgery because little
Mhm.
toe, finger, and you don't mind. You can go to any surgeon, but the eyes are our connection to the
Specialized.
universe. So people
Like
are
very.
very scared. So a lot of
Mhm.
times they're wasting money on drops to prevent cataract. Pie is the only
Yeah.
thing which can prevent cataract. Period.
Okay.
Nothing else.
Right. Really.
So
Mhm.
to
Mhm.
avoid, when to switch over is very important, and the book walks you through it. These things are
Yeah.
complementary, but people have said, oh, exercise can do away with LASIK, or you wear contact lens and sleep, your eyes will become good. So those things are just confusing the people and increasing the fear. So
Right.
we have to avoid the fear, but teach people how not to be misled by advertising, and how to
Sure.
find the person wherever they may be who can
Mhm.
match the checklist. It's like flying an airplane.
Mhm.
Before you fly, the pilot has to do a checklist to make sure everything is fine. As a
Right.
surgeon, I do that before surgery. All
Sure.
the
Sure.
tests have been done, the implants
Uh-huh.
are correct, they're backup implants, and something happens. So, but
Uh-huh.
patients need to do the same. And we provided a checklist. So if they check did these tests were done or not, because once the procedure becomes popular, as we've seen with LASIK, a lot of people take shortcuts to bring down costs, and that affects the
Mhm.
outcome. So
Sure.
we
Sure. Sure. That's right.
That's
avoid
so
with
true.
Mm. So, this is amazing. I mean, most people do think that the, average maintenance on the eyes is going to an ophthalmologist and let him measure you for glasses. I mean, of course, I mean, how do you maintain your eyes over time so that you have good outcome for your eyes? So a couple of questions. Average time for the procedure, and interesting comment though, what you put contacts in and you sleep, that enables you to see your dreams better.
Yeah, that's a good one. That's a
I
good one.
mean, that
Yeah.
doesn't make any sense, but amazing. So yeah, I'd like to hear more. How long was the procedure?
So the procedure is only 5 to 7 minutes.
Oh
Oh,
So
wow,
wow.
what,
wow.
what we do, and I tell patients, the procedure is actually 2 hours,
Mhm,
because we have to again get out of that thing where the doctor sees you for 3 minutes and he's gone and mumble jumbles. So the
right.
first part is make sure you can trust the doctor by getting your questions
Sure,
answered,
sure.
reading the book, and then all the tests have to be done, and you have to understand, because once the fear is removed, it can take 5 minutes. But
Mhm, mhm.
traditionally, it's been again wrong, because the way cataract surgery and other surgeries are done, everybody does, and you meet the doctor says for 2 minutes and tells something
Mm,
in medical journal, and then you go and get your
mhm,
so
mhm,
first the explanation. So how we do out of town patients, for example, my staff will do a video conference with them,
mhm,
explain
mhm.
everything about the thing, and then their people will read the book. Then
Mhm.
they'll talk to me before flying
Sure.
in, and all the
Okay.
analysis is done. When they come in, the tests take another half an hour, and then finally, based on the test, we have another one-on-one, and then
Mhm.
the surgery, the actual part is only 5 to 7 minutes, and then they fly.
Wow.
Our post-ops are
Wow.
That's
mostly done on FaceTime, because their
Uh-huh.
foundation is so strong. Patients
Okay.
know what to look for, and nowadays with all the technology you're mentioning, we can
Sure.
take pictures with the iPhone or on Zoom and check
Uh-huh.
things. So,
Oh.
uh,
yeah.
it, but the whole thing is based on the foundation, and the book is one of the cornerstone which other doctors, other surgeons around the world can use to make the foundations for the surgery.
Sure.
Because fear
Uh-huh.
is the main thing.
But
Yeah.
you seem to know all the details and all the the issues that a patient will face. And you're located in Cincinnati, Cleveland. I mean, Cincinnati,
No,
Ohio.
I'm located in Beverly Hills. I did my
Okay.
training
Okay.
in Cincinnati.
Okay, very
Okay.
good. Okay,
So
very
we're
good.
going to stop and we'll come back, and then you can tell us about the whole Beverly
This is exciting.
experience. This is very exciting.
you
So
added
here we
new-
are, Brightside Global Trade. You can get all this information. We'll make sure you get the links to how to buy the book and how, if you want to make an appointment with Dr. Khanna, we'll make sure you have those links. But in the meantime, we're talking about your eyes during the pandemic. This is Brightside Global Trade TV, and you can visit us on www.brightsideglobaltrade.org. Thanks for watching, and make sure you write us a comment.
Okay, very good, very good. That was good.